Good morning. As Norway's Consul General here in Houston, I first want to thank Houston Pumps and Pipes for including a segment by Norway Pumps and Pipes in the program of this year's summit. In fact, the Houston Pumps and Pipes Summit kicks off Norwegian Energy Week, taking place Tuesday to Friday, 9 to 11 a.m. Among the topics to be covered during the Energy Week are energy transition and outlook for the oil and gas industry, carbon capture and storage, offshore wind, digitalization and emerging technologies. Pumps and Pipes is the perfect example of the kind of interdisciplinary collaboration that is needed to meet some of the most pressing challenges our societies are facing. Whether it is transitioning to a low-carbon future to meet the Paris climate goals, or meeting health and medical needs of an aging population. This point was emphasized by Norway's Minister of Health and Care Services, Bent Høie, who described pumps and pipes as a simple and beautiful idea. This was in 2018 when medical and petroleum experts from Houston and Norway gathered for the first time in Stavanger to exchange experience, knowledge and examples of the transfer of technology between healthcare, oil and space. This month, it is exactly 5 years since the signing of the agreement here in Houston creating Norway Pumps and Pipes, making it the first project of its kind to be established outside of Houston. And of course, it is no coincidence that the Norwegian Pumps and Pipes program is managed from Stavanger, the energy capital of Europe and sister city to Houston. It is therefore a particular pleasure for me to introduce the project manager of Norway Pumps and Pipes, Dr. Tor Ole Gulsrud, presently head of the Department of Quality and Health Technology at the University of Stavanger. Mr. Gulsrud has the perfect background to manage the project, combining broad experience from some of Norway's leading petroleum research institutions and from the private sector. He also brings with him insight from the Technology Commercialization Program at the Red McCamp School of Business at University of Texas at Austin. Strengthening collaboration between Houston and Texas and Norway in the field of commercialization of innovative solutions and products is an important task for Team Norway here in Houston. The Pumps and Pipes project is a very important initiative in this endeavor, and we look forward to working closely with you all in the future. On a final note, I want to draw your attention to another area of transatlantic collaboration in which innovation in energy and medicine are producing great results. This is a partnership that was entered into in 2016 between Lawrence Livermore National Laboratory, one of the participants at this year's summit, and the Oslo Cancer Cluster, resulting in advancement in cancer prevention, diagnosis, treatment and care. This collaboration resulted in Norway being mentioned as a partner in the Cancer Moonshot program, headed by then Vice President Biden. On a personal note, I would just express my gratitude that the Pumps and Pipes program also have led to advances in the field of orthopedic medicine and surgery, having last week received a new brand new titanium hip. So on that note, best of luck and thank you for your attention.
Welcome to Norway Pumps and Pipes. We are now in the locations of Health Campus Stavanger, an innovation lab for the medical sector, for the energy sector and for academia. Since 2016, Norway Pumps and Pipes has been an arena for transfer of competence, knowledge and technology between the oil and gas sector and the health sector. In 2016, we received funding from the Ministry of Health and Care Services. And some of that fundings were applied to support pre-projects. We initiated 8 pre-projects within the Pumps and Pipes umbrella. And I'm very excited to tell you about one of these projects. It's called Tidewave. It's a mattress for rotation of patients that are not able to move themselves. Bed sores is an increasing problem globally. Why is Tidewave a Pumps and Pipes project? When they started to develop the mattress and the rotational module, they didn't have any knowledge about using pressure within automated pressure steering. So they went to the oil and gas industry in this region and they got help to develop the automated pressure unit. So this is why Tidewave is a pumps and pipes project. They applied competence and technology from the oil and gas industry into their product.
We started this company based on an idea from one of the founders' granddad, which was a technology developed in the 80s that was first developed for the oil industry. But in the 1980s, the founder of that technology flipped it around and made it into a mattress. And that was the basis for our idea. We developed a turning mattress that it can be put in any bed system. Firstly, curves around the user and then tilts from side to side up until 30 degrees. This slow movement will not be noticed by the ones sleeping in the mattress. You will get the movement that is needed in order to prevent and treat bed sores. We received Norway Pumps and Pipes funding early in the development of this company. And it has been crucial in order to early focus on the technology and find out what can we take with us further and what do we need to develop further. As of 2020, we have now finished the development of the product. We have for 2.5 years done pilot testing of the product in collaboration with municipalities here in Norway. And through those pilot tests, we have continuously developed the product into the solution that we have today.
So let me show you this brand new innovation lab, Health Campus Stavanger, which will be the home for Norway Pumps and Pipes. So in this innovation lab, we have areas for social meetings and for seminars and workshops. And right next to this building, they are setting up the new hospital to be ready in 2024. And also, close to the hospital, the Faculty of Health Sciences will set up a new building for the faculty, also to be ready in 2024. So in this innovation lab, we also have facilities for startup companies. And they can come here and do prototyping and testing and meet other startups. The new hospital is setting up 2 patients' rooms, which can be used for testing and evaluation of new equipment to be used in the hospital. So now we're back again in the simulation lab for the paramedics. Next, I will take you a few miles further south to a research and education center called SEARCH. SEARCH is an important part of our infrastructure.
Marianne Oropesa-Mo is my name. I am the CEO of the SEARCH Center, which is a collaboration between the Norwegian University of Life Sciences, the University of Stavanger, and the Stavanger University Hospital. We have a main idea and approach to what the center should offer, which is a multidisciplinary approach to research questions. Here you see the setup for an ophthalmologist wet lab course, where we use material from the abattoir and offer state-of-the-art courses for specialists within ophthalmology. We can offer practical training in suture techniques. We have acute medicine courses for health personnel, where we use, as you can see, mannequins lying on one table, and we have a live model at the neighboring table. And the animal model that we use mainly at SEARCH is the porcine model, or the pig model, mainly because it shows large similarities, both physiologically and anatomically, to the human body. Here you see a 3D printed model of the larynx with a piece of porcine skin over it.
Hello everyone, my name is Nils Petter Ovland. I'm the medical director here at the Search Center. I'm an anesthesiologist and a researcher here in Stavanger. And I'm really proud to show you this room because you are now standing, as you see, the room is not finished, but this is where we will have the state-of-the-art hybrid CT angio X-ray theater. And this is illustrated by this table here, this mannequin, and you also see this table here. This will of course be replaced by a CT scanner on rails that can move over the operating table here. What we can do here in the hybrid lab, we have CT, we have X-ray, we have all these new technology that will work as the best test bed that is possible to have for pumps and pipes in Norway, internationally, and we can collaborate in future projects.
In this region, we have worked a lot with different challenges within oil and gas. We have built up a great competence within simulation, especially the flow simulation and understanding of how fluids behave in porous media. Working with pumps and pipes, it was clearly a great match between some of these researchers and some other medical doctors. And they were able to discuss their challenges and the tools they had available to find new ways of solving these challenges. Taking data from one patient cannot validate a simulation model. So we decided to build up a synthetic flow system that could help us in validating the computational models, where you can simulate a pulsative flow and you can change the rate and etc. The system consists of an advanced pump that can simulate pulsative flow, which is important when you're doing simulations of human blood flow, of course. And we have a setup where it's based on the large arteries of a grown-up man. We have extracted the geometry of these arteries and made a model of this based on silicon tubes. So this gives us a more realistic model than just ordinary, simple, flat plastic tubes.
I hope that you have enjoyed this video and that you have got some insights into Norway Pumps and Pipes activities in the Stavanger region in Norway. And for the future, I hope that we can continue our collaboration so that we can solve the challenges of the future together. Thank you.